heart disease remains the leading cause of death worldwide, with heart attacks being one of the most common manifestations. A heart attack, also known as a myocardial infarction, occurs when blood flow to a part of the heart is blocked for an extended period, causing damage or death to the heart muscle. The sooner a heart attack is recognized and treated, the better the chances of recovery and survival. This essay will explore 5 critical warning signs of a heart attack that should never be ignored, highlighting the importance of early detection and immediate medical attention. 1. Chest pain or discomfort. Chest pain is perhaps the most well-known symptom of a heart attack, but it can manifest in various ways and is not always as intense as people might expect. Understanding the different presentations of chest pain can help in recognizing a heart attack early. Characteristics of chest pain: pressure, tightness, or squeezing. Many people describe the sensation as a heavy weight on the chest or a feeling of being squeezed. This discomfort is often persistent and does not subside with rest. Burning sensation. Sometimes, the pain may feel like heartburn or indigestion. It is crucial to distinguish between ordinary heartburn and pain that radiates to other areas. Pain radiating to other areas. The discomfort may spread to the shoulders, arms, particularly the left arm, neck, jaw, or back. This radiating pain is a key indicator that the heart is involved. When to seek help. Immediate action. If you or someone else experiences unexplained chest pain or discomfort, seek emergency medical attention immediately. Time is critical in the treatment of a heart attack. Do not self-diagnose. Do not dismiss the pain as indigestion or anxiety, especially if it is accompanied by other symptoms like shortness of breath or nausea. 2. Shortness of breath. Shortness of breath, or dyspnea, can be an early warning sign of a heart attack, even if chest pain is not present. This symptom occurs when the heart cannot pump enough blood to meet the body's needs, leading to a lack of oxygen. Characteristics of shortness of breath. Sudden onset. It may come on suddenly and can be severe. You might feel like you can't catch your breath or that you are suffocating. During activity or rest. Shortness of breath can occur during physical activity or even at rest. It might also wake you up from sleep. Associated symptoms. It can be accompanied by wheezing, coughing, or a feeling of tightness in the chest. When to seek help. Emergency situation. If you experience sudden, unexplained shortness of breath, especially if it occurs with other heart attack symptoms, call emergency services immediately. Monitor existing conditions. For those with chronic conditions like asthma or COPD, it is essential to recognize when shortness of breath is different from their usual symptoms. 3. Nausea, indigestion, or abdominal pain. While these symptoms are often associated with gastrointestinal issues, they can also be warning signs of a heart attack, particularly in women. It is essential to consider these symptoms in the context of other potential heart attack signs. Characteristics of gastrointestinal symptoms. Nausea or vomiting. Sudden nausea or vomiting without an apparent cause can be a sign of a heart attack. This is more common in women. Indigestion or heartburn. Persistent indigestion or a burning sensation in the stomach can indicate heart trouble. This pain might feel similar to gastric reflux. Abdominal pain. Pain in the upper abdomen, particularly if it radiates to the back, can be a sign of a heart attack. When to seek help. Consider context. If these symptoms are new, severe, or accompanied by other heart attack signs such as chest pain or shortness of breath, seek medical help immediately. Don't ignore. Do not dismiss these symptoms as mere stomach issues, especially if they are unusual for you. 4. Dizziness, lightheadedness, or fainting. Feeling dizzy, lightheaded, or faint can be a sign of many conditions, but it is also a potential warning sign of a heart attack. This occurs when the heart is not pumping blood effectively, leading to a drop in blood pressure and reduced blood flow to the brain. Characteristics of dizziness and fainting. Sudden onset. The sensation can come on suddenly, causing you to feel unsteady or faint. Accompanied by other symptoms. It often occurs with other heart attack symptoms like chest pain, shortness of breath, or sweating. Loss of consciousness. In severe cases, it can lead to fainting or loss of consciousness. When to seek help. Immediate attention. If you experience sudden dizziness, lightheadedness, or fainting, especially with other symptoms of a heart attack, seek emergency medical attention. Monitor recurrence. Frequent episodes of dizziness or fainting should be evaluated by a healthcare professional to determine the underlying cause. 5. Sweating and cold, clammy skin. Excessive sweating, particularly when accompanied by other symptoms, can be a sign of a heart attack. This type of sweating is often described as cold and clammy and occurs without any apparent reason. Characteristics of heart attack-related sweating. Cold sweat. You may break out in a cold sweat, feeling clammy and damp. Unprovoked. The sweating is not related to physical exertion or heat. It often comes on suddenly and can be quite severe. Accompanied by other symptoms. It usually occurs alongside other heart attack symptoms such as chest pain, shortness of breath, or nausea. When to seek help. Immediate action. If you experience sudden, unprovoked sweating, especially if it is accompanied by other heart attack signs, seek emergency medical help immediately. Recognize the pattern. Sweating in response to stress or heat is normal, but cold, clammy sweating without an apparent cause is concerning. Understanding heart attack risk factors. Recognizing the warning signs of a heart attack is crucial, but understanding the risk factors can help in prevention. Here are some common risk factors for heart attacks. Unmodifiable risk factors. Age. Risk increases with age, especially for men over 45 and women over 55.